Welcome back. In this video, we'll talk about the different types of hypersensitivity. Type 1 is known as the anaphylactic type, and it is the fastest. It basically involves an allergen or an antigen that would trigger mast cells and basophils to release histamine. This is done using the immunoglobulin E. So basically, an allergen would attach to immunoglobulin E, and the allergen immunoglobulin E complex would attach to a mast cell. And this, of course, triggers the release of histamine. Histamine triggers the inflammation process, so locally this presents as swollen area that is very red, hot, painful, and itchy. However, there are certain scenarios where this triggers a systemic response. For example, if a toxin is introduced into the body, like a bee sting. In this case, the bee sting toxin will circulate in the blood and will continue to activate mast cells all over. This causes systemic release of histamine all over the body and systemic inflammation all over. Most concerning, the inflammation process in the lungs collapses the airway, and so the patient will not be able to breathe. Luckily, the entire process can be inhibited by giving epinephrine, because epinephrine reverses the action of histamine. The second type we have is type 2, and this involves antibodies that would attach to an antigen, most likely a bacteria. The attached antibody does one of two things: either engulfing the entire bacteria surrounding it, thereby dysfunctioning it, basically inhibits it from moving, multiplying, eating, or excreting, or by triggering natural killer cells to kill this bacteria. If a bacteria has this antibody, aka immunoglobulin, attached, and then it bumps into a killer cell, the killer cell will recognize the immunoglobulin and kill the attached bacteria. It can kill it either by releasing cytokines or by engulfing the bacteria and eating it in a phagocytotic manner. The examples we have are the autoimmune hemolytic anemia, immune thrombocytopenic purpura, transfusion reactions, hemolytic diseases of the newborn, Goodpasture syndrome, rheumatic fever, and hyperacute transplant rejection. In type 3, we have an immunoglobulin or an antibody that would attach to an antigen, most likely again bacteria, and these two coupled would activate a complement system. Now the linked triad, the antigen-antibody complement, would activate neutrophils and cause the release of lysosomal enzymes. This triggers very strong inflammatory process with systemic symptoms. So locally we expect to see arthritis or vasculitis or inflammation in whichever organ this presents. And systemically we want to see fever, we want to see agitation, drowsiness, dizziness, nausea, headache. So basically systemic symptoms that the body is sick. The examples we have are SLE, polyarthritis nodosa, Arthus reaction, serum sickness, and post-streptococcus glomerulonephritis. Keep in mind this often takes days to develop, so it's not the fastest. The last type, type 4 hypersensitivity, it involves direct contact between an antigen and a T cell. The T cell will recognize this foreign body and attack it by releasing cytokines. So no antibodies are involved. And this is the only type of hypersensitivity where we don't see any immunoglobulin action. But this involves randomly moving antigen that bumps into the T cell, so it's the longest. It is often called delayed type hypersensitivity. The examples we have are contact dermatitis, such as in poison ivy or nickel allergy, PPD skin test, graft versus host syndrome, and chronic transplant rejection. So these are the 4 types of hypersensitivity. Thank you guys so much for watching, and hopefully this clears things out.